Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Hello. Happy Thursday. Happy Q&A day. All right.
Hello, everyone.
We love celebrating members in our Q&A. So this week I wanted to celebrate. She started the program at 71 out of 132 and is down to 11 in 7 months. So congratulations. And he started at 90 out of 132 and in 4 months is down to 30. Keep going. You're almost there. You're, just a few more modules and you'll get down to that fully recovered also. So it's just great to see how quickly, right, those symptoms can come down when we start implementing the strategies. All right. We can go to our first question.
Hi guys, can you hear me?
Yep.
How you going? I was on probably a month or a little bit over a month ago now. I was the one that posted the hamster wheel comment on the board. I made a mistake a little bit more recently and tried a vagus nerve stimulator. Obviously, I was pretty dysregulated before I tried it. Now, I kind of used the lowest end of the ramp up that they recommended, but that's kind of caused or led to a pretty serious symptom flare in the last week and a half. And it's kind of the first time in the 6 months that I've had PCS. It's given me nausea and dizziness, which I hadn't really had at all before. And then along with a sensation of kind of prolonged fatigue. I've had fatigue when I've had flares before, but it's usually kind of passed in a couple of days with some good sleeps and kind of resetting everything. And then I was kind of getting that almost dizziness and nausea feeling doing deep meditation and breathing exercises as well. I don't know if that's a thing, but I've stopped the stimulator now and I've kind of pulled back the meditation and breathing exercises. I guess the questions coming off the back of that were, can you overstimulate the nerve and then go into almost a parasympathetic overload? Because I guess previously my flares have been probably stress sympathetic overload related. And then if you have an overactive parasympathetic, what can you do?
Melinda, I'm interested to know what you think as well. But
I can start if you want.
Yeah, go ahead, and then I'll add my 2 cents.
Yeah.
Can I just ask a question before we go here? The vagus nerve stimulator, I'm assuming it was electrodes. Where was it placed?
Yeah, on the ear, or that middle part of the ear.
Okay. And it was just one session?
No. I did it for a week. I did 15 minutes for the first 4 days or something, and then just ramped up to 30, and then it started getting pretty bad.
Did you notice right from the get-go that things were worsening? Every time you...
No. It's I actually thought I felt all right, and then like I was just starting to feel like a little bit off. Like I hadn't felt like that before, and it didn't actually click until kind of 4 days after, or 3 or 4 days after I stopped using it. And I was flaring that. I was like, oh, that's actually what caused it.
And there was nothing else that you could have that could have caused the flare? Not saying
No,
that.
I mean, since I spoke to you guys last, I've kind of pulled everything back pretty significantly. I'm like just keeping it to a pretty consistent, kind of low stress schedule at the moment. I'm not working at the moment either, and I'm being pretty strict with like I'm doing buffaloes for my exercise ramp ups as well. But this has taken my threshold or sub-threshold heart rate from, like, I think previously I got up to like 135, and then now I've tumbled all the way back down to 100, and this is like the worst I've actually had it. I haven't, like, previously I would get back to 110 if I had a flare.
Yeah, why don't I start, guys? So I see this quite a lot in my own practice. So from my experience, what I notice is if people jump too soon into nervous system regulation, that's not just using your own body, that using a device, if there's underlying dysfunction, so eye, ear, neck, when it comes to post-concussion, it actually sends your nervous system more into dysregulation instead of being supportive. So some people will claim that this, a new flare in their symptoms or an exaggerated version of their symptom flare happens if they use like migraine devices or inner ear devices. I also hear this from people who do ear seeds as part of like acupuncture, vibration plates, any type of nervous system regulator. If you still have that underlying dysfunction in one of your systems, I'm specifically thinking eye, ear, and neck, that CAM can speak to, I do find it actually just creates more dysregulation in your nervous system instead of being supportive. So what I would say is it's just too much too soon. So I think you made a call, like stepping back from using the, which one were you using?
I use NeuroSim, but it's kind of probably
Neuro,
scared
yes.
me completely.
Yeah, so I've actually heard this from a lot of people using NeuroSim if they're still not really worked on some of the systems that can be dysfunctional before trying it. So that is a good thing to try once you feel like you're at your best level of regulation.
Yeah.
So what I've noticed is just taking a step back, leaving that device for now, and working more on using your own body to regulate your nervous system while you're working on some of those underlying reasons for some of the symptoms that you still have.
Yeah.
That being said, you mentioned I notice a flare, I notice more dizziness and nausea, you said, I believe, with deep breathing and mindfulness and meditation. Is that right?
Yeah, it was kind of hard to put a finger on it necessarily, but I feel like it might have. I don't know if that's
Yes.
actually related or not. Yeah.
Usually it's not increasing it, but when you do deep breathing or meditation, what that practice itself does is help you bring more awareness to what's happening in your present moment. And if you've had this disruption and dizziness or nausea, you're going to notice it more. So my best guess from what you've shared with us is that it's most likely you're just noticing those symptoms more when you engage in those practices versus that practice itself is aggravating your symptoms. So you could try just to do a more simplified version of it, or you could try a movement and breath practice or a movement meditation like the mindful walking. That can sort of help offset that acute awareness of the symptoms that have shown up for you. So I don't think that necessarily is aggravating. It can be, right? Meditation can really bring forward a lot of underlying pain or symptoms if not done properly. But what I'm hearing from you is that you've done it previously and it was helpful. Is that right?
Yeah, it definitely was. But I feel like those were kind of sympathetic flares. I don't know if that's necessarily right to call it like that, but they were kind of stress response flares as opposed to maybe triggered by something that would be activating the other branch.
Yeah, I'm not hearing any sort of like parasympathetic dysregulation.
Yeah, I agree.
I'm not hearing that. I'm hearing, previously you used meditation and breath work to support a state of sympathetic activation. So for anyone listening that's not really clear on that yet, that's just when we're in sort of a heightened state. So experiencing things like anxiety, racing thoughts, panic, overwhelm. These are things that happen when we're in a sympathetic state. What stimulating the vagus nerve is supposed to do is help initiate a parasympathetic response or balance out, bring down a state of sympathetic activation. I don't think you've moved into like parasympathetic dominance by any means. So that would be like a freeze collapse mode. We're not really able to feel anything in our body. We feel numb, low, depressed. And I don't think that's what's happening from what you shared with me. I think you've just dysregulated a system that was already dysregulated. So you've kind of just overdone it. Per se. So taking a step back from the device and focusing more on how to support your body, how to support nervous system regulation using your body. And you can find all of those in the course before jumping to a device would be probably most helpful right now. And thinking of this as just a flare, right? It's not a setback. It's just, oh, I tried something new. It caused these symptoms. That didn't help. Let me take a step back, go back to what I know is supportive, do some deep breathing, add some movement, try the meditation with movement instead of just sitting there and noticing these new symptoms. Give yourself time for it to settle back down because it will. And then maybe take another look, and maybe I'll pass it to Cam now, at what might actually still be dysregulated that can aggravate things using one of these stim devices. I don't know if you've had that in your practice as well, Cam.
No, I've never. I mean, I don't really practice all that much anymore. So I don't have any patients that I'm currently treating that are using these devices, but I think what you're saying makes sense. The reason I asked for electrode placement is sometimes there's ones that are placed on the neck. And when you're stimulating over top of musculature, you're going to stimulate those muscles too. And so sometimes the cause of your dizziness can actually be due to, the activation of the muscles in the neck, which can do that. Just in terms of the dizziness you're feeling with like meditation and deep breathing, are you sitting up when you're doing this? Are you lying down? What's your position?
No, yeah, I'm sitting up.
Yeah, just because sometimes like deep breathing, you're activating accessory muscles like your SCM and your scalenes and things that lift your rib cage, which are also attached to your neck. And so sometimes just doing deep breathing in that sitting posture can potentially just activate that musculature, which can make you feel a little bit dizzy. But also it can be a lightheadedness feeling, right? Like as you are doing deep breathing, you're changing your vasculature, right? You're changing the oxygenation in your blood vessels. You're causing potentially dilation in some of your blood vessels, and that can create kind of a lightheaded feeling, right? Like I do Wim Hof breathing every morning, and you kind of hyperventilate, for 40 breaths. And in the instructions, it says like, do not do this in water because you can actually pass out from doing it, and do it in like a lying down or recumbent position, because if you're sitting upright and hyperventilating, you can get lightheaded and feel dizzy. So it could be that type of response where doing deep breathing in that upright position might just be kind of causing changes in your vasculature, which makes you feel that kind of lightheaded dizziness sensation. It also has the activation of neck musculature that helps to pull your rib cage up when you breathe. So it could be that you may want to try when you're doing deep breathing to do it completely lying down. That might be helpful. But I also like what Melinda's saying, where adding some movement to the mindful practices might just help from, noticing those types of things.
Yeah, okay. That's a good point.
Yeah.
But like she said too, like this will pass. Don't get too freaked out about it, right? It's like, okay, we tried something. Okay, it caused a flare, right? This isn't the end of the world. You will bounce back from this, and then you'll be right back to where you were, and it'll be a nothing, in a few weeks. So don't get too concerned.
Yeah. Initially beat yourself up, and then you get over it. It just takes a bit of time.
Well, and oftentimes, like what I always say is like the extent of our pullback or setback is based on our response to it and how we see it.
Yeah.
If we see it as a like, oh shit, I really fucked up here, like then it's just gonna cause more anxiety, more more spiral, right? So you kind of want to be able to say, all right, I'm moving forward here, and try not to let it get to you too much, because it's our response to it that makes it worse and worse and worse. So
yeah, I think you guys mentioned that on the last one, and that was I've done a lot of work on that more recently. I actually bought that book that you recommended Melinda the Mind Over Mood, or Mind Over Mood. And like even that, just kind of looking at your thoughts and then kind of gathering evidence and looking at it from a different perspective and like reframing it is has been super helpful. So no, I'm
Sweet.
happy with all
Yeah.
that.
I think both Melinda and Cam have answered this really well. Just one extra piece of context. Any technology, whether it's TENS acupuncture or red light therapy or sauna, anything that's going to input something into our system, our body's own nervous system has to be ready to receive that input. And sometimes, especially when we're like, oh, cool, I've heard about this technology, whatever it is, for this case, we'll use vagus nerve technology. It usually is an idea of like you said, you started using it regularly. And like acupuncture, just right is always the best therapy, but too much can be overstimulating for many people, especially if you have already a nervous system that's hypersensitive. Now, maybe you've done some work in the past on the vagus nerve, and that seemed to have worked fine. Sometimes over time, we shift. It doesn't necessarily mean that we're worse off because we overreact to this, but this particular stimulus surpassed our kind of internal nervous system threshold.
Yeah.
And so that sounds like it's happened to you. And that's why I really like starting with the vagus nerve exercises every day regularly as if it was something like a meditation, because that is a way that we can stimulate vagus nerve function and then work our way up to using a technology. I think, whatever it is, it's like, a 2-minute vagus nerve session, you just start with 30 seconds and see how you tolerate that for a week or so and then work your way up. Okay. So
that's really good.
Yeah, you're not decompensated. I think you've just been a little overstimulated. Decompensated is like I'm spaced out, I'm like foggy, I'm nauseous, like all the excessive things on the vagus nerve function. It sounds like you just had a little bit of a hypersensitivity or overreaction. Last thing I'll say, some people that are maybe a little neurodivergent or they have PTSD or there is some sort of underlying reason that their nervous system's primed up, sometimes have a excessive reaction. So maybe I'm not saying this is for you particularly. I'm just saying in general for anybody listening, that group of people, those ones know who they are, where they're a little bit more hypersensitive. They have to be even more careful when they implement any sort of technology or therapy. Okay?
Yeah. Okay. Thanks very much, guys.
Yeah, great question. Hopefully you found that helpful. All right, let's move on to...
Yeah, my question is about low blood pressure. I feel very dizzy and nauseous, and I have this thing and very weak most of the time. And when I get up from a seated position, I'm just about to fall over, and I really feel bad. And it's not always, but in this period, it's been for a few weeks now where it's every day. And I'm just not sure how it connects to my other symptoms and what to do about it. Because if I go to the doctor, he'll say, "You're so lucky you have a low blood pressure." But I really feel bad. And I really feel that it prevents me from working out a lot. And I just feel like I have no power. I just want to close my eyes all the time.
Okay. Have you tested your blood pressure? Do you know what's low?
Yes. I don't know if it's that low. It's sort of about, what would you say, 96/60, something like that in average.
Okay. And it sounds like this is fairly recent. So is this happened over the last couple of weeks that you've started feeling poorly like this?
Oh, it's just sometimes. But these last couple of weeks, it's been very bad. That's why I bring it up now. And then I had a period where I didn't feel it so much. And some months ago, it was very bad as well. So it comes and goes.
Okay.
But mostly it's there.
And Melinda or Cam, do you want to ask any other questions?
Yeah. Have you tested it lying down and versus standing up?
Yes, and I don't have this. I took this test from the course, and it didn't seem that I had POTS, if that's what you're referring.
Yeah, the change in heart rate was not there.
No.
But what about the change in blood pressure?
It was not remarkable.
Okay.
Yeah.
As far as I remember, it's a while ago now.
So sometimes, like, people have generally, some people have a lower blood pressure than others. And then when they get into some sort of autonomic dysfunction after they've sustained a concussion, it becomes even more problematic and can be the cause of symptoms. It sounds like you don't have a postural blood pressure issue where you're kind of getting up and you're like, oh, I got to catch myself because you're about to fall over. That's, again, an orthostatic hypotension.
Well, that's exactly how I feel. I feel like when I get up, I feel like falling over.
And how long does that last for?
Not for very long. I just
5
have
seconds?
to lean to the wall for 20 seconds, and then I can move on.
Because like there is a normal, response. So essentially, when you have a change in position, your blood vessels have to calibrate and your heart has to kind of pick up the pace and your blood vessels have to then constrict when they were dilated. So there's things that have to happen, and that takes about 5 seconds or so. So it's common that people will experience something like that. And if you already have low blood pressure to begin with, that could be kind of part of it, right? So
I guess what I'm thinking is that, like, so on a big picture perspective, you sustained a concussion or any sort of trauma, a car accident, whatever it is. Now your body's autonomic nervous system, which already might have been running low to start off with in terms of your basal blood pressure, your regular blood pressure, it now is a little bit more dysregulated. So that's sometimes what I see happen. So that's just an underlying predisposition that's made a little bit worse by the trauma. Secondly, then there's an underlying adrenal dysfunction. Your adrenal system, if you haven't got to that section of the course, we have a whole lesson on it in my hormone section, and it regulates a lot of processes in behind the scenes, like our energy production in the morning. So if people are feeling extremely tired in the morning, sometimes that's an adrenal problem with cortisol. The cortisol is one of the main hormones. But your adrenal glands, which sit right above your kidneys, they also regulate your blood pressure. So one of the signs and symptoms of people that have adrenal dysfunction is that they have generally a lower blood pressure if their adrenal system is not working as well, not secreting the hormones as quickly as they should be. And so, there's, in that lesson, I go through all the different things to assess that and to kind of figure out if this is applicable to you. So that's the kind of bigger underlying thing. Now, the final thing I'm going to say is sometimes if you're noticing it more in the last couple weeks, there are other factors that can make this symptom even worse. Like, for example, not drinking enough, being dehydrated. And sometimes it isn't purposeful. It's because you were sick. Like, my family's all been sick for the last 2 weeks. And, you don't eat and drink nearly as much as you should during that time. And so sometimes it's like a viral infection that might trigger things and make things a little bit worse. So that's kind of the acute thing. But generally speaking, the adrenal system and then the hormonal and kind of autonomic dysfunction that happens after a trauma of some type can be what makes an underlying predisposition worse.
Yeah, maybe I should watch that lesson again, because I really feel bad when I wake up in the morning. I feel like I haven't slept at all, no matter how well I sleep.
Yep. So it's the hormonal lesson. It's in the modules that I do, kind of in the middle part of the course.
Yeah.
After the diet and supplementation sections.
Okay, I will try and watch that again and see what I can do about this situation.
Yeah, and then get some more insight, and then come back. Obviously, talk to your healthcare provider about it. I mean, we didn't talk about the worst case scenarios where someone has developed a heart condition. Like, there are things to think about on a big picture, but most of the time those are uncommon if it's just kind of come on slowly. Maybe one of the simplest thing is just try to increase the amount of water you're drinking and start taking a little bit more salt in your water, like an electrolyte with sodium. A lot of people avoid sodium because they hear, oh, it's bad for your health, it's bad for your heart, avoid it. That's actually not true for the majority of people. The only people that should be avoiding salt in their diet is the people that have high blood pressure and are salt sensitive. And how do you know that? Where when you eat salt, your blood pressure goes up. So you can kind of track it. So that's been kind of debunked. But most people in this program should be actually having more salt in their diet to support their basically their blood flow and their cardiovascular function.
Yeah, but I'm following the diet at the moment, and I'm eating quite a lot of salt and drinking quite a lot of water. So
okay, good.
I'm good. Yeah.
Good. Okay, go check that section out. There's also some in the resources section. If Nikki, you can post that where I talk about the adrenal system. But I think the 2.0 course, the hormonal section, I do a much better job of just making it succinct.
Yeah.
Other things that influence this particular thing, it's this process is called cerebral vascular reactivity. So basically it's how your blood vessels respond to changes in CO2 levels in your blood. And a lot of this is actually related to how you're breathing. So if you're doing like shallow chest breathing, which tends to come with anxiety and stress, and you're not activating the diaphragm and getting like nice deep diaphragmatic belly breathing, that will change the levels of CO2 in your blood, which makes you more reactive to these types of changes in position and exercise and those types of things. So,
now when you mention it, you asked if I did something different for the last weeks, and actually I did, because I'd skipped the mindfulness and yoga sessions that I used to do.
Okay.
So maybe that's has something to do with it.
possibly.
Maybe.
You know, for now, I would just say just try to just get up slow so that you don't actually pass out.
Yeah.
You know, and try to do kind of a couple nice deep breaths before you get up, just to maybe activate that a little bit, get some more oxygen in the blood. But yeah, there's, you know, what about other things, Paul? Like, you know, iron levels, blood sugar, you know, is that on your radar at all?
I honestly, those things I would say are probably more related to, feeling like really tired. They don't really impact blood pressure that much, Cam. So
Yeah.
they'll
But she's
impact
saying
like
she's feeling
focus.
really, like, even in the morning when she wakes up, she's feeling really drained and
Yeah, but blood sugar, it could be that. So some people, when they wake up, I've had patients that they're like, they wake up in the morning and it's like they're really anxious for no reason. And so sometimes that is a drop in blood sugar specifically. That's why we recommend don't fast on the Concussion Fix diet. We're very specific about what we include and we don't include, because a lot of people that have HPA axis dysfunction and dysautonomia or autonomic dysfunction, vagus nerve issues, they already have trouble dealing with low blood sugar. So we don't want to have any more big blood sugar dips and spikes. That's one of the reasons we avoid, really, really sugary foods. And not only is that unhealthy for us and our inflammatory situation, but also on the back end, there's a big dip. It doesn't sound like that so much because of the orthostatic nature of her symptoms, Cam. Like, I don't think it's anything else. Obviously, anytime there's fatigue, I always talk about getting your levels of B12 and iron checked. Absolutely. Like, iron can really cause that. So have you had any blood work done? I mean, speak to your family care or primary care provider here, and that they may give you some insight. I wouldn't jump on any medications, but they may say, listen, I want to send you for a cardiovascular assessment and I want to do some blood work. And I think that you'd have your bases covered.
Okay.
Okay?
Thank
Yeah.
you.
Okay, let's move on to.
Hey guys.
Hey.
So I have some good news actually. So basically, I went to the chiropractor last Wednesday. I think it was Wednesday. It was either Wednesday or Thursday. And the only thing I think that was different that I've never gotten before is he did this adjustment where he like pulled my neck, or like pulled my head back when I was laying on my back, and it like cracked my neck and it kind of hurt when it happened. But ever since then, my neck like doesn't even hurt anymore. Like barely hurts, and my neck has hurt for like 3 years, and my symptoms are also a lot better now. So I don't know if that's what did it, but I'm trying not to jinx it, but I feel like very good right now, actually. So
Beautiful. And that was Chappie, right?
no, I was also gonna say, so I've been seeing two chiropractors at the same time because when I started seeing Jason, I also saw another guy like a few days before for the first time that does like he does like some like weird stuff that I don't really know if it's legit. Like he does like pressure stuff and like it's like acupuncture, but he doesn't actually do like the puncture part, I think. And I don't know, I just started to feel better after seeing both, so I didn't know who was doing it. So I've been seeing both this whole time. And they do different stuff. Like Jason has been stretching my neck and like massaging it and doing adjustments, and this other guy has been doing like that pressure stuff and adjustments. So I didn't know if I should just see one or not because I felt like I was like slowly getting better after seeing both of them. And then like when I saw this other guy, it felt like it's like completely gone now. But I don't know, like I don't know if it was like an additive effect of both or if it was just that guy.
Yeah,
So
possibly.
yeah.
With I know how Chappie practices, right? So he'll do a lot of like ART, which I know is like super helpful. That seems to be what really helps my patients is when you do the ART. The adjustments are like a bonus, right? It helps to
Mhm.
kind of keep things loose. Um, so it's hard to say which one, but the fact that you're feeling so much better tells us that, keep doing what you're doing. Keep
Yeah.
going. Don't cut one off because you don't know it could be this additive effect that's really helping. So no, that's awesome. Finding the right neck care is so important for this because like you said, it's like you've been dealing with this for years and you've gone to a number of different people.
Mhm.
Right, and then now you finally found something that, okay, now we're, like, making some progress, right? And that's how good it can be with adding that and finding the right, type of treatment, so good for you, that's awesome.
Thank you. Yeah, I was just gonna ask if I should just keep doing what I'm doing because,
It seems
like,
to be working.
if I should just maintain what I'm doing basically and not, I don't know. I'm seeing Jason twice a week and I'm seeing this other guy once a week. So, like, do you think I should just see Jason once a week and then see the other guy once a week?
Probably. I think 3 times a week is probably a bit excessive because you can overtreat as well, right? Jason probably doesn't even know you're seeing this other guy, right? So he's saying twice a week. Um
Yeah. Well, I told him, but we didn't really talk about like how many times I should see him like since I told him that. So,
Right.
yeah.
Now, the way I do it, and this might just give you some insight, the way I typically do it is I start with just once a week with people. But if by the time I see you the following week, you tell me that I felt okay for like 2 days, but then all my symptoms came back and now I'm basically back to where I was, I'll then do twice a week to try and build, right? Like I want to see you before you start feeling like crap again so that I can actually build on that. But if I see you on Monday and then you come in on Thursday and you're like, actually, I'm feeling really good, then what I'll do is I'll say, okay, now I'm going to go from twice a week down to once a week. And now if I see you the following week and you're like, actually, I still feel pretty good, then I'm going to move you to once every 2 weeks. And if I see you after 2 weeks and you say, actually, I'm still feeling really good, I'm going to move you to every 3 weeks. And then eventually I'm just going to say, okay, you know what? Just call me when you need me, like you're good to go. And so you're probably at the point now where you're feeling really good. You probably don't need 3 times a week because you don't want to overtreat and then end up creating more problems. So you might want to say, okay, I'm gonna see, you know, this guy and then this guy, once each per week. But then if you're still feeling good, you might want to say, okay, I'm gonna see this guy this week and this guy this week. right? So I'll see Jason every 2 weeks and I'll see this other guy every 2 weeks, and you're just going to kind of overlap them. So you're seeing somebody once a week, but then you might be at a point where you're like, actually, I'm feeling really good. Okay, fine. I'm going to cut this one off and I'm just going to do this one now, but I'm going to see this one only once every 2 weeks. And then I'm going to eventually just be like, okay, I'm feeling pretty good. I'm just going to call you if I need you. Because once you have a neck issue or once you have any type of injury, it's going to come back. Like these are things that like it's going to be kind of one of these things where your neck is going to go off. But really the whole exercise here is finding somebody that you know can help you in the event that something starts to come back. And then you just call them, you go in, you get one treatment, and then you're good for another 6 months. Right? Like that's kind of how it goes if you find the right person. So it sounds like you're there, right?
Yeah. Sounds good. Thank you.
Yeah. So I would try to pare that back pretty quickly.
Okay.
Right? Move each of them maybe to like once a week, and then maybe start to stagger them. And then you'll find out, like you'll be like, okay, I feel like this one is the one that's giving me the most, so I'm just gonna stick with this one. I'm gonna cut the other one, right? I mean, it's harder for you to like cross the border and get into Canada and do all that, right? So you're probably gonna want to eventually just gravitate towards the one that's closer to you.
Yeah, that's the other thing. Like I'm starting work in a week and a half, and when I'm seeing Jason in Canada, it's like 3 hours out of my day, basically.
Yeah, of course, right. So you might want to just cut that one sooner, but I think for the time being, because you're getting such a good effect here, you don't want to cut it too early and then basically go back, backslide, right? So
Hmm.
maybe keep it for another, 3 or 4 sessions and then pull.
Okay, thank you.
Yeah, it's such an interesting balance, this balance between continuing treatment and getting overtreated.
Yeah.
I know that this is also a mental health piece for a lot of people because treatments are helping, they don't want to let them go. And it's sort of like this sense of, I'm starting to feel better. Something's working now. And starting to build that trust that that's going to last a little bit longer each time and allowing yourself to kind of space things out a bit. I know a lot of my clients will talk about, but I have to go. This is what's working. I need to keep going at this time or this frequency. So it might be a little bit of a balance to figure out, how to start weaning off without backsliding, as Dr. Cam said, and just giving yourself that time to find out a new normal that's going to help keep the progress you've made.
Yeah, thank you.
Glad to hear it.
All right. There is one question here in the chat. My hematologist recently says I have polycythemia vera and says there is no cure. My blood is making too many red blood cells in my bone marrow and thickening of blood. Risk is heart attack and stroke. She says it's very treatable, but will have to take baby aspirin daily and wants me to take hydroxyurea, which they haven't started yet. This is new since my last concussion. How would I be able to lower the RBC production naturally without drugs to thin the blood?
So basically, to my knowledge, there is no natural health product that lowers your RBC production. There's a lot of them that increase it, but not that lower it. So what the approach here is you're trying to, as she's proposed from a pharmaceutical perspective, you're trying to make the blood flow as smoothly as possible without clotting. So it's kind of like you're having a traffic jam on the highways of your blood vessels, especially when it comes into the smaller blood vessels, and we definitely don't want that in your brain or your heart. So there are some natural things, for example, things like turmeric, vitamin E, and even omega-3s can help blood flow better. And now these are not the equivalent or replacements for aspirin, so nowhere, shape, or form am I saying that. There are some things that, so at the end of the day, you have to balance like risk and benefits. The risk of taking a daily baby aspirin, I think, is very minimal, generally really well studied, and the risk of getting a stroke is really, catastrophic. So I think it's, you're trying to look at different options. Yeah, I mean, there are some other options, like make sure you're donating blood regularly. But again, this isn't it's not a very common condition. You got to really defer to the experts here and work with a healthcare provider to try to figure out what's the balance between the pharmaceutical options and then what are some natural options that might complement that.
Great. I know you need to head out, Dr. Hrkal,
Yep.
which is okay. There is one more question here in the chat that's more for Dr. Marshall. Anyway,
See you guys.
See you.
all right. So they are wondering if it's common for the eyes to take a long time to adjust back to normal after neck work. Accidentally. Their chiro works mostly on suboccipitals and scalenes, but takes 15 to 20 minutes for the eyes to adjust after she's been worked on. I believe my vision also struggles with my neck as I have issues driving and dizziness. Neck work usually helps with those symptoms for a bit. Just got an iron neck and that helps my anxiety as well. Most of my anxiety seems to be triggered from visual issues.
Yeah, so the fact that neck work changes your vision tells you that some of your visual symptoms at least are coming from your neck. And if you think about the feedback loop, right? When your eyes move, your neck engages, and that also feeds back to your eyes to tell you kind of where your eyes should be. Once you get neck work, it kind of changes the tension in those muscles that then changes the signals to your eyes, and everything has to recalibrate. So it's common for people to feel a little bit off for, like you say, 15 to 20 minutes after. That's just like normal recalibration of, okay, now the eyes have a new signal from the neck and they got to figure out how to communicate with this new neck. And then it kind of reintegrates and then, okay, everything's fine. Now, as long as you notice that overall the trend is improving, then I think, yeah, you're doing the right thing. Now, the other things that people often miss, right? You say they're treating like deep or suboccipitals and scalenes, but like one of the biggest things for eyes is SCM and deep neck flexors in the front. So you may want to add those components in. Also, if you chronically have tight suboccipitals, TMJ working in on the muscles like the pterygoids inside the mouth, up in the back by the upper back molars, inside the lateral pterygoid muscles, that has a strong relationship with tightness in the suboccipitals. So if you have a kind of a TMJ issue that's not being addressed, those suboccipitals are just going to continue to get tight, no matter how much you work on them. And also, if your deep neck flexors and your SCM is tight, that pulls your head forward, which jams up your suboccipitals and makes them tight. So I feel like you may want to consider telling your chiro to add in deep neck flexors, SCM, and pterygoid work to your treatment plan, and that might just give you more long-lasting effect from that treatment. But yes, what you're suggesting is completely normal.
Great. There's another one here. I'm thinking CCI might be responsible for my symptoms, neck clicking, etc. Does upper chiro, so a NUCA, sorry, can see if there's neck instability?
So, are you the one that said an osteopath diagnosed you with CCI? That's the one I saw in the news feed. It was like an osteopath, or maybe it was a direct message to me.
Yeah, no, it was on the news feed,
No.
and it also was a diagnosis that sent this person into like a lot of anxiety and worry. It was sort of like a diagnosis that created fear, which can really happen for people, if you kind of loosely throw these things around. But I mean,
Well, that's right. That's my question was, how did they diagnose
yeah,
it?
how did they diagnose it? Was it just kind of an off the whim comment?
Yeah, because
kind of created
based
a lot
on
of anxiety.
okay.
Yeah, I sent a private message and I sent the whole, I've been on a little bit of an anxiety train here. I made the mistake to go to Tasmania. I'm from Quebec City. A client wanted me there. And I did a 50-hour train trip, etc. And I never thought about the neck because I never had my neck checked since my accident in January with the whiplash and everything. I had MRI, I had CT scans like twice. I had a carotid dissection, which
You
healed
did
in 4 months. Now
you
I'm
did it.
11 months later.
You had a carotid dissection?
Yeah,
Okay.
on that accident. So 11 months later, I'm here in Tasmania. And a friend tells me about that osteopath he knows that is very good, blah, blah, blah. So I'm like, why not, But I never had a neck issue unless, except on the 4 days after the accident. I really slammed hard on the back of my head. And the next day, the whole neck was kind of jammed up. It was like that for 4 days. And then the symptoms started like maybe a week later. Okay, so long story short, I'm back in Tasmania, go to the osteopath, and he checked me up. He said, have you ever think about neck instability? Because for me, that would be my first concern. And then all hell break loose because I was so far away from home, no way to know. So I made the mistake to chat with AI, and that was the horror movie you can think about. So sorry, guys, about. But yeah, so now I'm finally home. The return was horrible, as you can imagine. And AI was even saying, don't take the plane, you might die, you might do this and that if you have CCI. So made the trip very hard. And here I am. I contacted a clinic in Ottawa who's doing the NUCA thing. And I also contacted the Fort Myers neck professional all over the YouTube thing that he says he can do prolotherapy, like the PRP, once the whole test bag is done. But that would be 5,000 US for 1 day. They do 12 different tests to check vagus nerve compression and everything there is to it. So I'm very tempted to go in that direction, even though it's the last thing I would like to do, financially wise. But it seems to be like the ultimate response to answer to what I really had in mind. So
Yeah, so it sounds like this suggestion has convinced you that it's true.
well,
Without any diagnostic proof of this, you're already going down the rabbit hole of this.
yeah. Well, but the diagnosis is kind of impossible to get, it seems, because I went to the ER and I told everything about Atlas and Axis and skull relationship, and they were like, we don't even.
Yeah, they're not going to know anything of what you're talking about. They're not going to know. Yeah, well, you're just in the wrong spot. You don't go to the ER for this. If you're concerned about instability, generally, like the easiest way to do this is like a flexion extension X-ray. Right? So they take an X-ray with you looking straight up in the air. They look at where things are, then they have you bend forward and they see, do the vertebrae move in relation to one another? Like, is one actually translating forward? Because that would indicate that there's some instability there. If everything stays lined up, generally don't have any instability. You can also do like a fluoroscopic, like a motion X-ray, where they kind of take almost something like an X-ray, but it's video, so you can see how you flex and extend. Right. So these things you can get, and that's kind of your initial assessment to see like, okay, is there actually instability here or not?
I had the flexion extension done, but it was a normal chiropractor. And he said, well, nothing seems to be wrong there. And then I asked him about, Axis and Atlas, and he was like a bit lost there. But I have the X-rays with me, and I can see, like when I'm an extension, I can see that there's a little gap between the skull and the Atlas, and Atlas axis is like a bigger gap. So I'm like, is it normal or is it not? And he couldn't answer. So that's why I'm. Yeah, sorry.
Yeah, I mean, you can send them to me, and I can take a quick peek at them. But yeah, generally it's like as long as they line up, you're probably fine. Like I don't know what gaps you're referring to, but
there's just like that little bone that sticks out, and it seems like it's supposed to be like right in the middle, and there's like maybe a 3/4 space on the bottom and a quarter space on top, where the skull meets that little bone there on the back.
Yeah, I'd have to see what you're talking about. I just don't, you know what I mean?
Definitely sending if it's okay with you. And
Yeah.
so I wasn't at the right place. And then he said, "Well, I'll make a quick fix." I said, "No, you're not touching me. You don't know what you're doing." So he was a bit pissed. I paid whatever I had to pay, and I left. And then I took that upper cervical rendezvous. Sorry, appointment here in Ottawa. So on December 12th, I'm going there, and I think this guy might know a lot more, right?
Yeah, possibly. I mean, like the symptoms, that you describe, they don't necessarily mean instability, right? Like they can be instability, but they can also just be general neck dysfunction that's not treated with upper cervical, right? The the upper cervical kind of crew, they only deal with axis and atlas. And most neck dysfunction is not just atlas and axis, right? It's everything. So if you go and look at my two-part series on manual therapy, like if you go to my section in the resources and you go to, I did a video on manual therapy and I did manual therapy part 1, manual therapy part 2. And I talk about all of the symptoms that go with it and also what the best types of treatment are for these types of symptoms. And I also talk about NUCA and like pros and cons, right? So NUCA is helpful for like the 10% of people that only have an issue in that area. 90% of the people with neck dysfunction have issues all over the place. So NUCA is not going to be helpful for them. It's going to be a huge waste. It's going to be a huge waste of time.
The problem I have is the dissected carotid.
Yep.
Everything that is concerning like more normal chiropractic work. Because from what I can gather, nobody can touch me until I die.
Yeah, I mean, I wouldn't be doing anything manipulation wise with you because of your dissection history, but I would still be able to do soft tissue work, which is the most important piece of this. So, I mean, I don't know if you have instability or not, but it sounds like, at least from the flexion extension x-rays you have, it sounds like you probably don't, which is good. So, but I mean, the NUCA person will probably take a peek and look, but they tend to look at these like subtle little shifts and they'll say, oh, this is out by like X degrees and whatever. And like, I don't know if I really buy all that because a lot of the evidence shows that you're like these things happen just based on positioning on an x-ray, right? If your head is slightly rotated, because everything has coupled motion, right? So if I laterally flex to the side, what happens is my vertebrae flex, but they also rotate because there's coupled motion just in how people move naturally. So if you're if you're slightly laterally flexed during the image, your vertebrae is going to slightly rotate because that's the coupled motion. But then if you take an x-ray of that, you can look and say, oh, look, see this vertebrae, see how it's rotated? And you go, oh,
Yeah.
yeah, that is rotated. And then now you're signed up for 6 months of treatment to fix a
Yeah.
problem that's not a problem.
All right.
Do you know what I mean?
Because
Because like how everything moves, little shifts, right? Like if I'm going to take an x-ray of you and I tilt your head slightly and I say, hold that position right there.
makes sense.
And you think you're straight and they've just lined you up slightly like this, it's going to look like things are off and they can show you on their x-ray that things are off.
Yeah. Like
And
putting
then
a brick under your foot and then saying your hip is higher on the left.
there you go. Right? So it's like the positioning of the x-ray matters so much. So you have to look at it more kind of globally. But a flexion extension, what you're looking for is like anterior posterior translation of different vertebrae on top of each other. And you can easily see that on a film.
All right. Well, that is not happening, but I definitely have a military neck since the accident or maybe prior.
Yeah. So military neck is more of a finding than a cause. Military neck is basically you lose your cervical lordotic curve, but that's usually because of muscle strain in the neck that keeps everything rigid.
Ah, okay. Yeah, I like that.
So if there's an injury, all the muscles tense up, and because of that muscle tension, the curve is not proper. So you can't adjust your way out of that. You need to do soft tissue to loosen things up and get things kind of getting back to where they are. So that's more of a it's more of a an effect than a cause, you know what I mean? Like
Yeah.
it's not like the cause of your issues are the military neck. It's like your issues are causing the military neck.
All right. Okay. Because in Fort Myers, he had the same opinion. He was like, well, it's very delicate. You can be like having like a 1 millimeter difference, and then he wants to get me on the 5,000 day thing.
Of course.
Yeah.
Of course.
So all right, I like that.
And I just wanted to jump in there before we say goodbye because it's great. Dr. Cam's able to sort of help support you and guide you with next steps for treatment. But
Yeah,
some of the underlying things you're sharing with us are really anxiety driven that you mentioned.
really.
And so
Yes.
that's a big part too, to sort of think about, how can I best manage the anxiety that comes when I think something's imminently wrong with my neck? Like you said, it sounds like the trip home from Tasmania was really overwhelming, that there was a lot of things that happened that made you feel worried about your own safety. So sometimes when we see too many providers and get too many different consults, we're actually just feeding into our anxiety. So I like Dr. Cam's suggestion about like choosing someone close to home, sticking with, one, maybe max two treatments, building trust with those providers, working with the program, with the nervous system, reestablishing a sense of safety in your body. Because what I'm hearing is if something triggers you, you get into an anxiety spiral that's really unhelpful as far as how to support yourself. Is that right?
Yeah, big time. And I've been looking, on your chapter where everything seems to make sense, and I like it. The meditation aspect, I'm already on it, and the psychological thing. But if I don't have that neck instability thing checked, it seems like there's nothing. I'm still on that loop because I cannot calm myself down because there's no way
Yeah.
to know.
So that's part of, anxiety, building tolerance to having anxiety is
Yeah,
recognizing that some things aren't always going to have an exact answer, right? Maybe it's three different things. And that if we can build some awareness to seeing the neck issue as a potential three different things that are happening, and you're going to work on them gradually over time, um, and rest assured that it's also important to find that provide those providers that you trust and are accessible to you, not millions of miles away, that is going to take a lot out of your day to day just to get there and see them. It can help settle that anxiety. So there's other ways to work on that too. And I think that working on your anxiety can also really help with how urgent the anxiety becomes, and the urgency you're having to get an answer, because that's a bit of a slippery slope. And I talk a lot about this in the program because it's a very common issue with our PCS group. Is there becomes this urgency to understand why and have the exact answer as to why this happened to me, or what my risk is of something getting worse. And that's just a slippery slope that creates more dysregulation in our system. So building up some skills to tolerate the anxiety, to having some uncertainty about your neck right now. I know it doesn't sound as reassuring as this hunt for why and making sure you find all the answers for why, but it is a really important component of working with PCS, because sometimes we do live with uncomfortable symptoms. Of course, it's important to recognize what is an urgent symptom we need to take care of and what isn't. But if we're constantly working in that overdrive, right, that state of anxiety, it's dysregulating our nervous system continuously and creating more symptoms over time. So it really is an important piece that I would encourage you to go back and revisit. Sometimes people like to go through my sections with their own therapist in their area to really hone in on areas that could be helpful for you. So,
yeah,
for example, without kind of covering this piece, if you were to sort of jump in, you find a provider that's helpful for you, they tell you you don't have CCI, but you might have this, maybe your anxiety goes down for a little while. But the next time you have a flare and there's something uncertain, then your anxiety is likely to spiral and get bigger and continue in that same cycle. So one of the important parts of the program that we really address is how can you build some tolerance or some coping skills to work with that anxiety so that next time there's a bit of a setback, we're not freaking out, right? And it makes sense to freak out when we can't work with anxiety productively and we don't know what's happening. But there are real coping skills that we've built into the program to help support this exact situation. So that might be a good complement for you to work on both.
yes. All right. Yeah, makes sense. yeah, I'm freaking out because I cannot train anymore, and I'm a kung fu teacher. I've been training for 40 years. I'm an inheritor of the kung fu system. The family's pressing me, so I'm like, yeah, a little lost on that.
Yeah,
It's very hard.
there's
But
other demands.
yeah,
Yeah.
so I'll chill out and address those things. Yeah. Anyway, the harder I do training or anything, the harder the bus hits me. So I have to, yeah, breathe and relax.
Yeah, I mean, it's okay to take breaks too from if something you're doing in your life just isn't working right now, right? Work on healing and strengthening and supporting that anxiety. Sometimes life, calls us to pivot for a little while, and that's at times really helpful to redirect our lives to support this. It doesn't mean you won't ever get back to doing those things, but maybe it's actually just aggravating things, this pressure to get back there
Yeah, I think so.
right
Yeah.
now. Mm-hmm.
And I got to relax the chin tucks because I learned that it's supposed to be good, but now I'm working on the muscles so much. I feel like it does help, but like Dr. Cam was saying, maybe those muscles are pulling on that neck after all. So,
Well, that's why we don't recommend doing the rehab exercises until you do the manual therapy side. Because if you do have dysfunction in the neck, doing chin tucks or strengthening exercises can actually just reinforce that dysfunction and make things worse. So now your symptoms actually start to increase and worsen over time. So that's where the manual therapy side comes in. So anyway, send me a direct message and we can kind of go from there.
yeah, thank you so much. All right. I
Great.
appreciate it.
Great spot to wrap it up for today. Thank you for all the questions and the comments in the chat. Hope everyone has a fantastic day. Bye.
Bye-bye.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.